everybody.
Hello.
I've got my vet tech Tracy here, and she's going to do Muffin sub-Q treatment today. And we're waiting for the audience to come on live because Tracy can take your questions. This girl is a wealth of knowledge. It's amazing the things I'm learning from her. Hi, Annie. So, one of the things that I'm especially concerned with is how do you know when your dog is sick? And this is something that's really been bothering me because, like, Muffin was fine and fine until she wasn't. And I didn't think about it. Hey, Roberta. I was like taken off guard
Yeah.
by, that something so serious could happen right under my nose.
Yeah.
And then I'm like, well, the food I gave her was bad. It was commercial Caesar food. I thought, you want to trust the food producers,
Yeah.
but I
You never
can't even
know.
trust them to feed people. How can we
Yeah,
trust them
you
to feed
never know.
dogs? Yeah. Although I have to say, just to quickly off topic, well, on dog food topic, did
Yeah.
you know that Thailand is a huge maker of dog food?
I didn't know Thailand specifically, and it's terrible. I don't know, none of us really know as much about dog food as we should, and
Yeah.
it's a big problem. But I did know that it's not here that's making it, and it's somewhere farther away, like than it should be. So I knew that it's not necessarily the best. I have a lot of, as you've
Well,
talked about, GI issues.
yeah,
like
well,
wondering about
right.
food.
Right, but actually, as far as the Thailand dog food goes, I
Yeah.
researched it pretty hard because I had bought her Caesar food, and the first it said it was made in the USA, and then I bought another kind that was Caesar bowls, and it said it was made in Thailand. So I was like, oh my God, is this terrible? I looked it up, and they actually treat dogs better than humans in Thailand.
Good.
Yeah,
Good.
that's what I found out.
There you go.
I wouldn't be worried about giving
It takes a lot
my
of
dog
research.
food from Thailand.
Yeah, it takes a lot of research when it comes to food.
Yeah.
Not my forte, and it's not, I think, a lot of vets' forte, and it's really unfortunate. I think just in this area, we need to learn a little bit more. And one of my coworkers was just saying that.
We do. I mean, we need to know everything about what we're eating, and that goes for our pets too. And so, some of Muffin's problems, I do believe. Well, okay, I don't know. Let's just put it this way. I really don't know. She's 16 years old, and so it could be anything. But then again, it could be something. So you have to make a change, right?
Yeah, you definitely don't want to be feeding certain foods when your dog has kidney disease or pancreatitis. And a lot of the times they do recommend like a home diet of boiled chicken and white rice balanced with veggies, as if they're not going to eat the kidney diet. Now, what's in these kidney diets? I have no clue. I don't know what the ingredients are, but they are making it.
You're talking about the prescription
Yeah, like the
food,
prescription diets. They're making it specific for the kidney.
Okay.
So it's obviously going to be low sodium, but what else?
But yeah, well, that's the thing. When you
What
look at
else?
the ingredients list, you see glycerin and you see carrageenan, which
oh my God, it's so I don't
she
know.
was telling me about carrageenan yesterday. It's like the worst thing.
I don't know enough, but I do know when it comes to kidneys, disease, that they do say it is fine to cook for them. Obviously, bland, healthy, balanced. And I would be doing that before I did a prescription diet personally myself, because I have my doubts and my suspicions, and it is a rabbit hole that I can't take the time to go down. Because,
and it's expensive food, I'm just saying. So,
but I can also sit there and say, I recently adopted 2 older cats, and just trying to transition them onto my food didn't go well, and they had diarrhea, so I gave them a food that's specifically for diarrhea, and all of a sudden some of their other problems started to resolve. Respiratory problems. So on the other hand, I can sit there and say there are some diets that it starts with your gut that can be helpful. We just don't know enough, and all I know is that unfortunately these corporations are putting stuff in these foods, and I don't know enough if it's good or if it's bad. And
for people too. This talk is for everyone.
They're just doing
animals
so
and people.
We don't know. So it's one of those things that you can't go crazy over, but if you have the time to be mindful and look things up like you did, like I wouldn't have known, I would be hesitant, but now I know, all right, Thailand's treating their dogs better than we are.
Yeah.
So, yay, Thailand, thanks a lot.
I didn't find anything bad about
Good.
Thailand dog food, and
That's
it did seem like
very
it was
reassuring
a
then.
good thing. So,
Yeah,
I mean,
very reassuring.
but we are encouraged to really buy things from America. And actually, that's another one across the board. That is why our country has the problems that it has with the bad
Yes.
food and everything, because Americans have been so focused on saving money at the expense of healthy, whole,
Yeah.
organic food.
And also
It's horrible.
costing people more money when
In
they
the
know
long
they
run.
need it. So things that are the
Oh,
most
that too.
helpful, like insulin, costs an arm and a leg, and you don't have a choice, you need it. So it's
Good
just a
point.
very slippery slope, I feel, and it's just sad. And I've got a lot of thoughts
Well,
about that could go
and
on
a lot
forever.
of times too, also the needing of insulin
Mhm.
now could be alleviated by diet.
Oh yes, 100%.
So,
Like
yeah.
if, especially humans, but we have seen it with animals as well. It's not as easy again because it comes down to food, it comes down to diet, and who knows what things are actually being in it. And I'm dealing with this with another client who has an older dog, a little poodle who's diabetic, and she put him on a specific diabetic diet, and his blood sugar went up, and it was not helping.
Oh my gosh!
It was
Oh,
making
no.
things worse,
Oh,
and
wow.
he had also liver issues. So
Oh, wow.
Dan and Mary, and we were just seeing all these other issues. So I don't think it was helpful. But that was that diet, and it's that dog who is more sensitive. It doesn't mean for all. I'm not going to sit there and say like don't do it.
That's a very good point too. Is that everyone is different.
Yes.
There is no one size fits all
Yep.
in any situation, actually.
But whole foods, organic foods, if you are able, I'm always encouraging that.
It's the
Try
best.
that first, because then you know exactly what's going into your body, their body, and you kind of can't go wrong.
And by the way, I am not a cook. I hate cooking.
Yeah.
I'd rather make reservations. But
Yeah.
but just saying, it's really easy to cook a chicken. I just
Yeah.
found that out. I bought a whole organic chicken. I boiled the crap out of it, and then I was like, well, this doesn't look cooked. So then I put it in the oven for like half an hour, and it's so moist and delicious.
Yeah.
So, and Muffin's yumming it up.
Yeah,
should
they
I
like
let her
that.
go eat a little bit?
Yeah, if she wants to.
She
Go for it.
seems
We can
to-
answer
she's
some
like,
questions.
I'm out of here.
I was gonna say, I know there were some on there I didn't 100% see, going back some of the questions and everything.
Yeah,
but
yeah. Well, so Annie has a really good point that there are a lot of side effects to any medication that we
Yes.
take and that they take. So, like, I have to wonder, is the Muffin's taking something called Denamarin, which is good for liver function, and Serenia, which is against vomiting.
Yes.
And now she's foaming at the mouth.
Yeah, so we were like talking about how that can be a sign of nausea, and the Serenia will help with that. But doing a bunch of medications that each treat something differently, putting them all together isn't necessarily the best thing, because each has side effects, and you don't really know for your pet what those side effects may or may not be. So I know with humans a lot of times that will happen, where all of a sudden
little shark attack there. Somebody just asked if we were drunk. Yeah.
Yes.
Oh, we're wasted.
Of course. Yep.
Yes.
I am.
Where's your cocktail,
I know.
Tracy?
I'm a mom in the middle of the day. I guess.
We're gonna do sub-Q on the dog, but we had to get toasted first. Yeah.
Well, listen. Hey, if you are day drinking, cheers to you. Have one on me. Enjoy your day. Live your best life.
For sure.
It's a Sunday. Everybody deserves
That's true.
downtime.
There's no judgment here, by the way. We're not judging anybody.
But no, I am not. I drove here, and I don't drink or drive. So there's my public service.
It's well, we actually had a talk right before we went on, and I told her about the shark attacks and what I do to the trolls. So we don't want to feed the trolls by any means, but it is nice to make fun of those who would come on the page and try to, I guess, get a rise out of us or something. But
to each his own.
We just make fun of you. So if you're gonna come on and say something stupid or nasty, we will make fun of you and feed you to the sharks.
Yeah. The sharks need to be fed.
They do. They're hungry, you know. Sharks
need to eat too.
Critters too. Exactly.
Yeah. So side effects with medications. Every medication has a side effect, and I tell people that, majority of the time they're safe. I have immune compromised kids who have issues, so it does not mean that your pet would not have a reaction to something. So vaccines, medication, it's all the same thing. We see pretty adverse side effects that we wouldn't expect, so it's not to say that it doesn't happen.
Yeah.
But 9 times out of 10, everything is pretty safe. Serenia is really safe. We use it as part of our pre-op protocol to help patients when they're going under anesthesia. It helps with pain and it helps with nausea. And I have been doing this a very long time, and this is the first practice that I've been at with that being as part of a protocol, and seeing them wake up out of anesthesia like nothing happens. They're not screaming in pain, they're not crying out, they're not panting excessively, they're not throwing up. So I can speak for Serenia as it is really amazing. I'm very glad we have this product available.
That's good to know.
I find it safe and helpful. But there are some products out there like non-steroidal anti-inflammatories that are going to
I
have
wanted
side
to
effects.
actually talk about that too, because
Yeah.
I suspect that
Mhm.
Muffin's kidney issues could
100%.
be directly attributed to, she's been on an NSAID
Yep.
called Piroxicam for
100%.
like 2-3 years.
Yeah, so when you are on an NSAID, that's what a non-steroidal anti-inflammatory is, you need to check their kidney and liver values every 6 months. It is in your dog's best interest to do a wellness panel, or an early detection panel when they are at their annual. It is blood work that we send out that checks everything going on internally. It's checking their kidney, their liver function, checking for signs of diabetes, their white blood cell count. There's a reason we suggest this. We're not trying to make money. It is in your pet's best interest, but you don't have to do it. But it'll help you to catch the start of
things
something.
early.
Catch things early.
However, I do want to say there's a lot of people who will say, my dog's never been to a vet and they're super healthy,
Yeah.
or my dog goes to the vet all the time
God
and
bless, that's
always
great.
had
Yeah.
problems. So,
I see
think that
both sides of
yeah,
that.
there's
Honestly.
totally both
Yeah.
sides. However, I gotta say, Muffin was a rescue from a puppy mill. She was, when she was a baby, she's giving me side. Wait, you guys have
Literally, I was like, oh
you
man, she's
have
like,
to
Mom.
see this face. Look at this. Look
She's like,
at
just
this face.
stop.
Muff.
She's like, I'm over it. You guys
Muff.
talk too much.
She's like, oh, and now the camera's on me.
Oh, Muffin.
So Muffin was a rescue from a puppy mill. We don't even know how old she was when we got her, but we know she was between 7 and 9 weeks old.
Yeah.
And she had fleas, and she's like, oh man, Mom. She had a lot of issues going on. She was less than a pound. I mean, she's not very big now, but she was super tiny, and she had, I think she had worms. She had like a lot of stuff going on.
Puppy mill dogs are going to come with intestinal parasites and diseases that puppies get that are fatal, because they are not necessarily protecting them while they're all enclosed in these unsanitary conditions. So
yeah,
she probably went through the ringer. Yeah, you.
Yeah, she's like, I was.
She's like,
yeah,
I did.
I don't remember it, but yeah.
Oh my God, I love her so much.
She's so funny. But yeah, so anyway, when we got her, my daughter took like 2 weeks off of school and just nursed this dog to be the most adorable thing I've ever seen in my life. And she got back to the vet a month after we got her, and the vet said that she was shocked that she was still alive, and we were like, what?
It can be really scary for little puppies. They're tiny, they're smaller, and they don't have a lot of immunity, and a lot of the cases don't go well, and it's sad, and it's avoidable, it's unnecessary. They don't need to be bred to that extreme. You can still get your money's worth by just doing the right thing by the animals. So
yeah, so Muffin has actually been under veterinarian care since pretty much day one, and she hasn't had to go to the vet a lot in her life, but I was telling you earlier that she did have Lyme disease at one point.
Yeah.
And the vet didn't catch it because up in Philadelphia area where she was seen, they said that they don't even test for Lyme disease. They just think that all the dogs have it, so they don't test for it.
Which is so silly, because you can test for it and see where their levels are and see if they have an active case going on or not. I actually had that happen with my daughter where they checked for a tick disease after I saw a tick on her, excuse me. And then it went undetected, and then sure enough, a year of like issues, we went to an infectious disease doctor who was able to find a different tick disease and said, well, they don't check for this at the pediatrician. I was like, well, maybe we should be when it's in this area because it's obviously there and been causing problems forever. And it's the same with dogs.
And sure enough, she did have Lyme disease, and I think that was kind of the worst thing that ever happened. But now I want to call everyone's attention.
She's trying to make her bed.
Oh my God, she's like, I'm going to sleep now. So if you see how her back is a little bit hunched like that, that is a sign of pain, isn't it? Or of something.
Yeah, it absolutely can be a sign of pain. It could be a sign that she's hurt her back. But when they come in hunched over, we're looking at their back. We're going to feel and see if there are any injuries and try to see if we can elicit pain along the vertebrae or the abdomen. It can mean either one of those, but it definitely is a sign of pain. So is panting. If they come in and they're panting, that could be a sign of pain. Drooling, pain and nausea. Sometimes it's things you wouldn't realize. They're not just going to yelp out in pain all the time.
No, actually, Muffin's very stoic and doesn't tell us
the word
when
we use a lot.
She's in pain. So I don't really think of that, but the vet did give me gabapentin and say that she does need it twice a day because she does have pain.
She does have pain, and being stoic, sometimes they don't show it, and it's important to keep their pain under control. And on the other hand, you could say, well, I don't want to keep my pet because gabapentin can cause slight sedation. I don't want to keep them sedated and groggy and not themselves, but being that they can't talk to us, we have to make sure that we're treating their symptoms, and there is pain internally going on. There's inflammation, when they have pancreatitis, inflammation of the pancreas.
And that's going to be painful.
Yeah, that the pancreas is inflamed. It is in pain. That's why they have pain medications, and they're not necessarily going to be crying out constantly. It's just internal, and it's there. So
here she comes.
She just did a lap.
She does. She's like,
I'm going to go lay down, and then she said, no, let me just go and check everything out, make sure everything's how it should be. Now I need a drink.
So in her younger days, everyone knows Muffin loves to walk, and I would take her for walks, and we would hours of walking, 4 miles.
Amazing.
She loved to walk.
I love that.
And so now she just walks around the house because I can't, I can't take her outside for big walks anymore.
Yeah, it's a little bit too much for her little body. Exercise is good, but just like we get older, we can only do so much. So you get like a little doggy stroller.
She has
walking,
it,
but she doesn't
Everyone
actually
knows
have to do
about
the walking.
One of my followers bought her stroller.
Oh, that's
Shout out
awesome.
Deborah. And it was the greatest thing ever. She loves to be in her stroller because she loves to be with people.
Exactly.
And be
she doesn't have to
outside.
give that up just because she's getting older, just like we don't.
Yeah, there's a lot of things that you can't do. But one thing I did want to talk to you guys about was the fact that I've been beating myself up about Muffin being sick and well, what did I miss? And, it's the food and I did that wrong. And it just, like this.
Shoulda, coulda, woulda.
So exactly. But we were talking about this and I'm now realizing that, hindsight, it's not helpful.
Yeah.
And there's nothing I can do back then now differently because what has happened has happened. However, now I know, so I need to move forward and I need to make sure that what I do now is the best thing for her, which is why Tracy is here. And also I want Tracy to help you guys too, as far as, we miss these things. Now I've missed the fact that she was hunched and that meant that there was something wrong. I really didn't think about. I thought that's just the way she is, or just little things that I'm like, oh, that was a sign and I missed it. But so now I hope that we all can learn. And if I ever get another dog, which I feel like I never want to go through this again. And
it's not easy. Not at all.
And I've said it before.
Years,
it's like, and it is a long time. And I actually didn't want Muffin in the beginning because of this.
Yeah.
Because I had just lost another dog. And I
so
don't
hard.
believe in replacing dogs with dogs, but a lot of people do it, and it's the best thing for them,
on one hand, There are dogs that need homes,
There
so
are.
yes, please adopt, don't shop, but on the
Hmm.
other hand, you go through this long journey, 16 years. It's like your 16-year-old child.
It
It
is.
is
Yeah,
a
it's my
long
child.
time.
It's my
So
baby.
you don't just necessarily go and get a new kid after something happens.
Yeah.
So it's not for everyone. It's not easy. It's really hard to do that. And I lost my one cat last year and happened to have another. She was all gray, another like gray kitten come into my life right before she passed. And that instant, I adopted that cat out. I was never planning to keep her. I was just bottle feeding her. She was abandoned. She was abandoned for a reason. She was not a nice cat. She was very spicy. But she was also gray. Elsa was gray. And I was like, I am not replacing my cat. I was like, I don't want her in my home. She's 9 weeks old. Like, she's ready to go to a new home. It took me about 3 weeks to find the
You
right
still
person,
have that cat,
but
don't you?
I don't
Oh,
know.
you
So
don't.
I
Okay.
did get her home, and it was the best thing for her. But I felt that way, like I was replacing Elsa, and there
Yeah.
was no replacing
And you
her.
couldn't do it.
And I don't even know if I could ever get another gray cat because of that. I always wanted a gray cat, and so Elsa was my gray cat. So it's not easy, but sometimes, you know, animals come into your life at the right time. So I always say never. You may end up with a dog and you weren't planning on it, and then here you are.
It
But for
happens
right
all the
now,
time.
Muffin is living her best life, and she may be 16, but it doesn't mean she doesn't have 5 more years left. So fingers
From
crossed,
your
we're gonna
mouth to
do
God's ears.
everything for her. And like you said, now you know
Yeah.
what to look
Now
for.
I know.
So moving forward, if something were to happen, you can say, all right, this is what it may mean. This is what I may think. And if you're not sure, you can go to your vet and ask and say, hey, listen, this is what's going on, and hope it's something minor, and be prepared if it's something major, and just keep moving forward.
It's just like people, we can only do what we can do. And, God is going to take you when it's your time, and you don't know when it's your time.
Yeah.
Hi, Darla. It's something like I can't imagine losing a dog before their time, like hit by a car or something tragic like that. That's never happened to me, thank God.
Yeah.
I just like that's the worst thing. I've had one of my dogs had a bad fall and didn't kill her, but I mean it was because she was blind and I didn't realize that she couldn't see and she went right
Until
off
it
of an
happened.
edge.
Yeah.
Exactly.
Yeah.
And that's another thing. Like Muffin started having
Hi, Mama.
photo sensitivity to light.
Yeah.
Now I'd gone through that with my dog Bunny, so I
You
knew
knew.
what was going on where I didn't know before and I didn't realize what was happening. Okay, here she comes.
She's decided to join us.
She's like, I think it's time for my sub-Q treatment, Mom.
What do you think? Huh? I know. Oh, this is my good girl.
She knows.
Oh, shake it off.
Yeah, she knows. It's time for your treatment.
Oh, you got to rub too? Of course. Yeah.
Yeah, rolling is part of the Shih Tzu world.
Yeah. My other sub-Q patient does the same thing. The 19-year-old, I have a 19-year-old Yorkie poodle mix that I do, and after he gets his fluids, he's doing the same thing. He's rubbing me off of him and rubbing all the bad stuff, and then getting himself feeling better again. Right?
Yeah.
You guys would be besties.
Rolling's always a happy thing for Muffin.
Yeah.
She likes to roll.
Oh, yeah.
I think that's great that she came over to us for this because
that's her way of saying, okay, I think it's time, and she's not unhappy with it. Obviously it hurts at first, but she knows ultimately that it is the best thing for her. She feels better afterwards, and that's a great thing, and that's what we want. So
well, and something else that we were talking about earlier too that I'd like to talk about with you guys is the communication that you have with your dog. A lot of times you think that the vet knows best, but that's not true. You're the one that knows the best.
100%.
And you should never ever doubt your instincts when it comes to your dog. If you think there's something wrong with your dog, there's something wrong with your dog. I mean, even if the vet says
if it's so tiny and it's simple, it still matters. And I tell that to my patients all the time, my clients all the time. They come in and I'm like, you're a pet best. And sometimes they say, even if it seems silly, when they've had a surgery, I'm like, and you're not sure, call us or text us. I would rather know than not know and reassure you. We just had a cat come in. They said he looked like he was hiccuping. He had abdominal breathing, and he was in for an ear infection, and we gave steroids, and whatever effects, as you guys know, steroids have severe effects on your body.
Yes,
So whatever
severe.
happened,
Yeah.
and it wasn't the wrong thing to do the steroids. And again, you don't know. We wouldn't have known to look and do x-rays and check his heart. We listened, everything was fine. And basically, this wasn't a hiccup. He was having abdominal breathing. And I was so appreciative that we have a nurse line at the hospital where I work, and they were able to text a video, and I could sit there and say, okay, well, a hiccup doesn't need to come in, but this wasn't a hiccup. It was a abdominal breathing. This cat was in distress, and we were able to give this cat the care that he needed. So, for me, I'd rather know than not know. It's never too small of an issue to bring up. We are only going to be able to figure out what's going on through the parents and us. We are professionals, but you guys know your pet best. You're with them every day. You know what's normal or not. And I would rather know than not know, because, this is the only way that we can communicate, is this energy and our relationship.
Exactly. So Ginger says that she has to deal with her mother's little papillon, and it sounds like, Ginger, are you going to euthanize that baby? Is that what you're talking about? I'm so sorry. She says this week, and she's dreading it.
You know what? We were talking about this too. First off, this is not an easy time. It is the most humane thing. It's called humane euthanasia.
Yeah.
You are not necessarily making the wrong decision. You know your pet best, and we don't want them to suffer. And humans don't have this option. We are not able, we're suffering, withering away in a hospital bed from cancer, and can't eat, can't do anything, but yet they're continuing everything because we don't have the option to say, because they believe mentally we are suffering, so we aren't making the best decision. But guess what? We are suffering, and sometimes that is the best decision. And again, you know your pet best. You know if their quality of life is where it needs to be. And we discussed this yesterday, things about quality of life. You have to look at your pet as a whole and make sure that they are okay, they're comfortable, they're happy, and they're not suffering. So, it's not an easy decision, and my heart goes out to you to have to go through this.
Big time, Ginger girl. Love you.
But
so sorry.
You know what? Your pet is going to be okay afterwards. They're not going to be suffering.
So yeah, I've actually gone through where I did have to euthanize my little dog Bunny, and it was the most heartbreaking thing I've ever done. I never had done that before, but when I did it, it surprised me how quickly it happened.
Yes.
1 minute she's
quick.
there, and the next minute the needle, and it's over.
It's part of the conversation I have when people come in. I ask, have you ever been through this before? Even if they have, I let them know what to expect. But sometimes you just don't realize how fast it is. But it's not a bad thing, because you don't want to prolong that.
No, for sure not. So it's not a bad death. In other words, it's very quick.
It's quick,
and it's painless.
Yeah, and they're not aware of it. Most of the time, doctors will give them something beforehand, just like they're going under anesthesia, that helps sedate them.
Exactly.
So
my dog was sleeping at the time.
So they do not feel anything. I've worked for some vets where, we didn't necessarily do that, and protocols are always changing, and sometimes it wasn't a smooth procedure. And that is really, really difficult in everybody involved.
Yeah.
And so they're constantly adopting protocols, and I'm very fortunate to work at a very compassionate vet who makes sure that it is extremely peaceful, so that everybody isn't suffering through everything. So
Ginger's been through this before, but yes, quick and humane. At least you know what's gonna happen. I think
what to expect.
I think it's harder when you go through this for the first time, and
it is,
and it's been your dog for so long. I mean, it's just terrible. Not that it makes it any easier, Ginger. My heart goes out to you, absolutely. Let's do the sub Q on Muffin right now, because she's ready.
She is ready.
She told us.
And they said the fact that she came back to me now means that she does like me, and I appreciate that. But even if she didn't, she knows that I'm the one that's she's like, wait
she's rethinking. I don't know if I do like you.
It makes her feel better. So even if she's not fully aware and sure of what's going on, this is making her feel better, and she knows that she needs it, and that's what's important. So when you are doing this, yes, they may squirm or cry, and it's like really hard to hurt our pets, but it is what they need. It's the best thing for them, and the pain is temporary. It's just a quick little second, and then we move on. So
Yeah. Yeah.
all right.
So some of the people watching yesterday when we did this video, they said that they actually did do this for their own dogs,
Yes,
and that
yeah.
it's that if I just watch you do it, I probably could do it at some point. I don't want to do it.
Listen, you don't have
I
to.
don't wanna do it.
You may feel differently at some point, but
Yeah.
there are resources available, like I said, at your own vet, so that you don't have to.
Well, I love that Tracy is here in the
Yes.
house, and Muffin,
she's most
did not
comfortable.
have to go anywhere. We
It can be
didn't
very
have to,
stressful.
we didn't have to like go in the car, and she, she knows the vet. She
Yeah.
knows she's not one of those dogs that freaks out at the vets,
Yeah, but some
you know,
do, and
she doesn't want to
they
go there.
smell things, they sense things that we can't possibly, and so it can be very stressful going there. So you absolutely have that option, but it's really nice to be able to provide this option to people at home.
It's
So it's just
important.
easier, because this is a very difficult thing to do, and I can say I don't know how well I would do if I had to do this on my own pet every single day. If I had a diabetic pet, it is a challenge. I don't know that I could do it, and I am in this field. I'm a professional. I don't know that I could do it, so I don't want people to feel like they have to. But
Right.
I'm always here to help teach people.
I think
so
it's
that
wonderful
they can,
that we have the option.
Exactly.
But if you don't want to do it, you don't have to do it.
to.
It doesn't mean you don't love your dog enough. It doesn't mean that you're
Yeah.
a bad dog mom or anything.
Yeah.
I just personally, I've always been squeamish. I'm never going to give anyone a shot.
It's a big needle, and listen, she's a teeny tiny dog, and
I don't want to do anything wrong.
Yeah.
If anything happened and I did that, I could never forgive myself. So I'm so lucky that I have Tracy here. Seriously, this is a really huge help.
It's a very rewarding field. It is very taxing as well, but seeing Muffin doing better, and like you guys said, she came over to me, that makes me feel great, because she doesn't have to. She could bite me, she could run away, it could be a challenge, and she's not doing that. So that to me is the greatest gift, the best way for her to
I
say
love
thank
that
you.
we're not forcing her to do
Exactly.
this. We let her walk off. She didn't want to be with us at
Yeah.
that moment. She went, she had a snack, she did a couple
Yeah.
loops around the house, and
Yeah.
then she's like,
we
what, guys?
listen to her body cues.
I'm ready.
We are, listening to her. That's what you have to do. You know your pet best.
And so that's another thing that we also were discussing is the communication that you have with your pet. And you have to realize that you're having conversations all day long with your pet, whether you know it or not.
Yeah.
It's so subtle, it's so ingrained. Even when Tracy got here, we weren't talking to each other, but I also was and she also was having a big conversation with Muffin, and Muffin was involved. Her tail was down. She was like, I'm not so happy Tracy's here right now. And I'm like,
she doesn't love this, but it took her a minute, because she associates me with the needle, to realize I'm not just coming in and stabbing her. That's how I personally handle situations. I don't just come in and do. I come in and I have a relationship first, and then she calmed down, she felt the energy, and now she's choosing that she wants to have it. So, it's not always
right now
possible.
She's like, would you guys shut up?
It's not always possible just to come in and, do and go it, or vice versa.
All right, let's get this show on the road. Let's let little Muffin move on with her day.
And so, like, we've been doing this a certain way too. She's very comfortable here, so I'm not going to sit here and say, okay, move her. I'm going to say, let's try doing this right here and see how it works. So again, I'm gonna.
Is this your good side though? Didn't you have a way you like to do it?
I was just gonna say. So again, her head is facing this way, so I can do that. I'm gonna make the scruff. I'm gonna make my little tent. This is where I'm gonna be poking. So yeah, if you want to see, I'm doing it with the needle on. A lot of the times when I do demos at work, that's what we do. We show where it's gonna go rather just doing. And I always offer people, if you want to try it here with me, then instead of going home and realizing you can't. So.
Right.
I am going. Oh, she's out of here.
She's like, wait a minute.
I think she's gonna do this pretty much.
I'm gonna put the camera back up here.
She's at least gonna fight. If she wasn't gonna fight, that is also a way that I'd be like, hey, listen, we've lost that, like energy. What's going on? But I'm going to wait because as you guys saw yesterday, this is the third time. This is kind of what she does when you first go to do it.
Mhm.
So we will let her reposition, get herself comfortable, and then we will give it a go. And you can always switch how you're doing things. It doesn't have to be the same every single time. Okay. Okay. Okay.
Okay. Oh,
Okay.
okay.
So
All right,
I
it's
was
okay.
in,
Okay.
but I didn't fully go in where I was through
Okay.
enough to give her fluids. So usually the second time she's fine. So I didn't keep doing it. I'm not gonna push it and have her get hurt and be stabbed and have it go through. Excuse me. So we're gonna let her settle herself down.
It's okay, baby. It's okay.
See how she wants to go, if she wants to be in this position or not. I'm gonna talk to her and say it's okay, right?
And also the music here, this is dog healing
Yeah.
frequency music, which actually even calms me down.
It's
So
very soothing, very
it's
relaxing.
really
I can
helpful for
actually see it
everyone.
because you see when she gets a little bit worked up,
Yeah,
but now she's
yeah.
settling.
Yeah.
I think she's feeling those vibrations and she's feeling calm. And so when you are anxious and they feel
That's
that
the other
anxiety,
thing.
we're staying calm. So I think it's helping her be like, okay, wait, I don't need to be anxious. I am anxious. I feel anxious, but I also feel that they're calm, so I can calm down a little bit.
Yes, exactly.
All right, Mama, you ready?
We're ready. All right, baby girl, we're gonna do this one more time. You can do it.
It's okay, Mama.
Okay. Okay.
It's okay.
Okay, baby, we're okay.
Sometimes you have to like prepare them and like I'm massaging here, letting her know something bad isn't happening, and if I can massage and do it beforehand and then do it. Excuse me.
I think also it being her third time, she knows now. She's
And
like,
this will happen. Sometimes they get wise to it, and then you have to constantly change what you're doing. I was dealing that with a little dog with insulin. We had to just continuously change. Once he got used to it, he would say, "Nope, I've behaved. Now I'm not going to behave," because he didn't like it and didn't want it. And he was very sensitive, so that's totally fine.
you know, baby, let's try this, huh? You gonna be okay?
You ready?
Get ready,
What do you think?
girlfriend. You can do it.
Let's try it again.
Okay, it's okay.
It's okay. It's okay. It's okay. It's okay.
We got you.
Oh,
We got you.
oh, it came out.
Oh,
So that time, what I
We're
did
having
for
a
you
hard
guys
time
to know
today.
is I tried to hold her head a little bit so that she could just allow it to be in and realize, oh wait, it's not hurting me, it's not doing anything. But the needle, excuse me, wasn't totally in, so it came out. So now we have to try again. And just so you guys know, if you poke more, I would say more than 3 or 4 times, you can change the needle. I'm gonna get one ready.
Yeah. Boy, yesterday was
Because
so easy. Today we're
she's like,
having,
you're on live. I'm
Yeah,
gonna make sure, but
definitely.
the needles get dull. So when you're doing this, something I didn't mention yesterday, you don't
Okay.
want to use the same same needle every single time. You want to change it because it'll be dull, but also, you don't want to be like infecting them. There are germs, bacteria, and everything. We're still going in, so it's sterile when we first go do it. So I'm gonna get this ready just in case. Sometimes I'm a believer, if I do this and I have it ready, it'll work this time. But if it doesn't, then we have it ready and we can just change the needle because I don't want it to be dull. I don't want it to then hurt her more than it would have because we continued to try to use the same needle. So these are just scenarios that people deal with all the time. For all we know, like she's just not having it and it's not going to be as easy. So if we need to do a little burrito, as I call it, and use a towel, we can do that. We can wrap her up where then you can hold her a little bit more and she can't wiggle out. Sometimes that's what it takes. It takes a little bit of restraint, but we have to find what works best for her,
All right,
for Mom,
so
for me.
What about this little
for
football hold I got on her?
Yeah, there you go. And you can do that where you're holding her legs down so she can't jump and push off of you. So we're going to see. And I'm not worried about her biting me. That is something that could happen with other dogs. Look.
Oh, I don't know about this position. She's like,
and exactly, communicate that.
Mom,
say, listen,
that's
this
not
isn't
working for me. All right, let's try this one again because it did work.
Oh my goodness. You
Wow, we're
energy
feisty right
today.
now.
Hey, relax.
Okay, all right. Okay, I guess we're not doing this right now. Oh my goodness.
Oh my gosh, Muffin. All right, let's just.
Seriously?
You want to do something
okay.
else? She's
Yeah,
like, we
all
we
right.
were doing all these other things.
Yeah.
Do you want a chicken chip?
Yeah, would you like a chicken chip?
I know that we
Get
only
it.
have a few left, and I'm
Yeah.
gonna grab more. But
Get a
sometimes
chicken chip.
using
We're gonna give you a chicken
treat,
chip.
something positive, will help. I'm gonna break it up into little
Yeah,
pieces.
that's a good idea.
So that
So we don't run out of the chicken chips.
well, because this way she doesn't eat the whole thing, and then we have to do it, and then we don't have it.
Exactly.
But we can.
All right, look what
Here.
Tracy has. She's like, no,
Here.
Mom. Look, it's a
Emma.
chicken chip.
A little piece at a time, and
What
then
you can have.
positive association, positive reinforcement.
She knows it's coming,
Yeah.
right?
She does,
Yeah,
and that's the thing.
yeah.
So she may not want it today. She may be feeling well enough that she's like, I've gotten so much fluids the last we did
Yeah.
this since what, Thursday?
Enough with the fluids.
So Thursday, Friday, Saturday, this is the 4th day.
Yeah.
She may be getting her spunk and her energy back. This is
Well,
not a
she's
bad
certainly
thing.
wild.
This
right
is,
now.
did she eat that or did she just
No,
knock
it
down?
fell down.
Here, Mama.
Look, chicken chip.
And you know what you can also do is like let her go and come back
Yeah, here, go.
on her terms.
Go. Off with you.
But-
Go somewhere.
If I were to be doing that, she's like,
Wait a minute, there's a chicken
she's
chip.
well, I think she's like, this isn't big. Like, this isn't what it normally is, but it smells good. But sometimes if I were doing this on my own, I would have to hug them to me
Yeah.
in order to do that. Because at work, even sometimes we don't have an extra set of hands. We have to do things by ourselves.
Yeah.
Giving injections, doing things you really should not
Eating
do it
the
by
chicken chip.
yourself. But sometimes these things happen and you do. So there are ways to kind of manage this. But I am not one of those where I'm like, I have today, sometimes I do have back-to-back clients, but I don't have to leave.
Thank God
I'm
for
not
that.
going to force it. Even if I did, that's when you go, all right, everybody else, we're just going to,
She says, give me that other chicken
for the big
chip.
one. She's so smart. She literally is going for the big
She
one.
knows all about it.
But now she's not like reacting as much to what happened. She's like, all right, wait, I like the chicken chips. I'm not reinforcing negative behavior. I'm distracting her and saying, here, let's be calm. And then what we do is, you could do this after every time she gets her fluid, she gets a chicken chip.
Yeah.
Maybe not before.
There
and
we go.
There's that
Okay.
association with her getting it after the fact. So maybe.
I don't know.
It's not 100%, but younger dogs, you could definitely trick
Right.
with that.
Yeah. What they say about not teaching old dogs new tricks.
It is 100% true.
Yeah. So would mild sedation make it easier for her? Actually, she did have gabapentin before this.
Yeah, so gabapentin is something that
I did
with
do that.
some other anxiety meds we give to patients before they come in that we do need to be a little bit more sedate. She has gabapentin on board. I don't have to sedate her to do this.
Yeah.
This isn't a dog that's
And it's not
thrashing.
really painful.
It's not painful. She's not trying to bite me. If we had a dog that needed this, we would give them, as long as they were able to, a calming protocol to help them to come into the hospital so we could do this, and we would all work together as a team to make that happen. But I don't actually need to sedate her to do this. But
And
mild
she's also
sedation,
not running away from us.
exactly. Mild sedation would be beneficial for anybody that is trying to do this and they don't have that on board. Know that there are options available for you, as long as your doctor obviously would be choosing something safe. As long as you're listening to the doctor and giving them as prescribed, you can give something to your pet in any situation. If they're nervous before going to the vet, if they're needed for the groomer, for car rides, for travel, you absolutely can get something that can help. And luckily, Muffin has stuff on board. Obviously, it doesn't seem like it, but she gets it regularly. It's more treating her pain than it is being given now as a sedative. But we do put on the labels it might cause slight sedation because
it does in Muffin. Actually, they were giving her 8 milliliters of it. Is that right? Milliliters? 8. That seems like a lot. Whatever 8 is.
Is it a capsule or is it liquid?
No. It's liquid.
Okay.
I have to give her liquid. She doesn't do well with capsules.
It's probably
but,
0.8.
0.8 exactly. And that really, gabapentin. I call it gabba-dabba-doo. And I gabba-dabba-dooed her.
I like that.
It was a bit much. So we have her on half that much
Yeah.
now, which makes a difference.
That absolutely. So like if you can give that 2 to 3 times a day, so I would have to know what her dose was to be able to sit here and say, okay, yes, let's give her one now because we're not getting it. If we get to that point where we're not able to do this and we have to add something on board, we definitely do.
Right.
That's the beauty of having a great vet med team. And hopefully you guys know that you can advocate for yourself and your pet as well as, you know, your team. When you go to your doctor, you make sure you're just getting the best care that you can. You know your pet best. You know what they need.
Chicken chip in her hand there, Mom.
Come here.
She's like, where's the chicken chip?
Yeah, so now you see, she's like, wait, this isn't so bad.
Yeah.
She's saying, it may not work. It may not make any difference. But you know what? She's going through a lot. I'm not going to sit here and not give it to her. I want her to be okay. And we will get it done. So.
Yeah. By the way, chicken chips are like.
Oh yeah, it's like crack.
I think there's crack in them or something. I don't know.
Most pets at the vet like it, but they don't always take it from us.
Yeah, Muffin will not take a treat from anybody else. Not a person, only me. She just doesn't trust anything.
My other sub-Q patient, we were using just human beef jerky to do it because he would scream and he would wiggle, and it was like traumatic. And he doesn't do that anymore. We figured out exactly what works. It's been a few weeks.
She's like, you got chicken chips in your hand.
Yeah, you take it from my hand now. And so we figured out what works, and we don't need. Oh, she's licking me.
Aw, you get kisses.
She wouldn't take it before, so look at that progress, right? So now she's associating the chicken chip with me.
And she's a tough customer. She doesn't just like everybody.
Building bonds, you know. I can't expect her to be happy every time I just come in and poke. You and I talk.
Right.
They appreciate when you just come in and you're acting normal, but yeah, some want attention. Some are like, I don't want to deal with all this other commotion. Like, let's just get this over with.
Yeah.
Who knows? They only have so many ways to tell us. So I have to
really
make up these stories in my head and figure out then what works best and be like, okay, it works better when we do it right away. Or when we take more time easing into it.
And knowing her as I do, if she hated this, if she was so upset, she'd be gone.
Yeah.
she would be over there, but here she's like, well, I know she's got chicken chips, so she can't be that bad.
Yeah, exactly. So I'm gonna save this little piece.
I'm gonna save that.
We are gonna see what works.
You're
I like to
have
get my
that afterwards.
ready. I don't want to be sitting on my butt, and that's not the way to, you know, get the job done. And now she's eating, so we want to make sure we're not licking.
Oh, now we're all wild.
Because licking and her head bobbing isn't helpful.
Yeah.
Hey, relax.
Remember how you were nice and calm
miss.
yesterday? My goodness. Okay.
I'm like, she's not just wiggling, she's bucking.
Yeah,
she's
like
freaking
out.
Now.
She's like a wild dog.
That's okay.
You are very wild.
See?
She says you don't have chicken chips. I don't like you anymore.
It's okay.
I'm not giving you kisses.
Okay. Yeah, she's not
chicken
gonna.
Chips.
You want another piece?
Is that a question? Oh. She's like, no.
She's like,
you tried to do it again. I don't know about you. I don't know.
And the thing with using like a towel, like I said, burrito, it either is going to give a little bit of that deep pressure to help calm and cocoon them, or
it's going to make her freak out even worse.
And we're not necessarily going to have access to her legs to like hold them down. So it's an option, but it's not necessarily the best option for every situation. You just try things, and each time you try, you kind of figure out what works best, and it takes time.
All right. Well, I don't know. I know she's calm. I know.
I was gonna say, like, if I went to the other side, me getting up and doing that's just gonna cause commotion. But it's okay, Mama. It's all right. I know you don't like it. You don't have to like it. Sometimes we have to do things we don't want to do. My mom used to say to me all the time, and I live by that now. I say to my kids all the time, I'm like, oh my God, I get it now.
And this one has 5 kids.
Yeah.
5 kids.
5 kids, 5 cats, 2 dogs, and a husband.
Yeah.
Yeah.
She's got the whole zoo there.
Happy house. What do you think?
Oh, I don't know.
And you see every time I go to touch her neck, association.
She's like, no, this is not cool. I don't like any of this.
If I had 3 hands, what I would do, I would hold here, I would hold her hand down. And
so do you want to get the blanket? And
we can definitely try that.
We're going to try the cocoon. This way you guys get to see all the different methods that are needed.
And see if it works or if it doesn't.
Yesterday worked so well, and you didn't really have to see anything major.
Get it flattened out. Okay. Put it in her, and basically you want it to have the open sides out, and then we're gonna attempt
She's
to
like, I know you're trying to do something
burrito
crazy.
her.
Oh yeah, she's like, I'm gonna burrito you.
There we go. See how I just kind of wrap that around?
Oh yeah.
You want to get her feet in. I don't know if they, yeah, they can still see. Literally, it's a burrito. Now, I have to be able to get in here, but what I'm doing right now is I'm just bundling her up. I usually, when I'm at work and I'm holding them, I'm rocking them like I am my kids because, 14 years of rocking. So, relax. It's okay. Yeah. And sometimes it takes doing this and letting them know that they can't get away with it. Sitting here saying, all right, you want to get away? Well, guess what? I'm still holding you. And now she's associating with me holding her. And she's like, oh, wait, like I have a dog that I walk. I love her. I just started walking her. And she likes to jump on me when she doesn't want to go. She gets to a certain point, she gets really anxious. And every time I redirect her, I make her sit. She follows her commands really well. She sits. And then I keep going. And it got to the point where she stopped doing it. And I was like, you literally aren't scared. You're just doing this to see what you can get away with because you don't want to walk. She doesn't need to go for this walk, but she needs mom wants her to. So I'm letting her know you can't do this, and we just established a good routine, and it worked.
Well, Christine makes a good point that Muffin at this, she's not trying to get away with something. She's just scared.
Exactly.
Yeah.
She doesn't like it.
Yeah.
So I understand. It's a big needle too, and I think I saw somebody had said on one of the comments maybe yesterday that they used a smaller needle.
Yeah.
I'm doing that with my other patient.
It takes a longer time.
Takes longer, but it works. She has a large amount to get, so if she sits still,
so
it works.
Yeah.
But see, now she's kind of just, I'm allowing her to be calm. The minute I take it out, she's gonna stop. But it's just like kids with autism; they just kind of need that deep pressure to feel a little bit better, and that's all I'm doing for her right now. I don't know that this is gonna work. I don't know that this is gonna help. This is just an option. You don't know until you try. So, yeah.
She's like, oh, I'm onto you. She's very smart. You're
one. Licking a lot. Is there something stuck in your mouth a little bit?
Yeah, I think that's her fear response.
Yeah. Like a nervous tick,
Yeah.
Okay, Mama. I know. That's a lot. Remember, it makes you feel better.
Yeah, it is. It is new, Christine. Wait. Oh, you guys, give me a sound check. Somebody called me. Sometimes that ruins things. Oh, no sound, man. All right, I guess I have to go out and do this all over again. Oh, back. Okay, thank you, Darla. All right, then we're good. Yay! Thank you for the sound check. Oh yeah, and we have the I have that my little
I wonder how we were sounding.
my little receiver here. Yeah. It was underneath Muffin's blanket, so I hope we weren't muffled. All right, Darla's giving us a good okay sign. Okay.
So for me to do the fluids, I need access to
here.
So,
you sure do.
The burrito, you have to find the right towel and the right way to do it. But it might be one of those things like if I'm here and I was able to do it myself, I could just hold her like this and then just pull up here and poke. She has so much skin where I could go a little bit further down than her neck to try to give it. It's just, I'm not one to sit here and say, all right, let's go ahead and try to do this one-handed when I know she's going to wiggle a lot and I'm not going to have the full control.
Right.
But it is a possibility once we establish the routine with her.
Okay.
To be able to do. It's something that you would
be able
to do by yourself. Exactly. But that is not
which I'm not ready to do, guys. I'm not ready to do. Exactly, Pam. The things we do for our fur babies. Yeah.
Yeah, honestly, like if you were having these issues at home and you came in, you are someone that I would be telling this is not possible at home with how she's wiggling.
Yeah.
You are going to need help with this.
Definitely.
And if anyone's telling you you can do it on your own, with
time.
Yeah.
It is very new to her. She is scared. She doesn't feel good.
Yeah.
So, kudos to the situations that go well the first time, no problems. That is a blessing.
And you
That's
might
not
be
always
right.
realistic.
This is her 4th day of it, and she
Yep.
maybe really needed it badly, and now
Yeah,
she's
and now
feeling
she's
good,
feeling
and she's
better.
like, I got this.
Yeah, she's getting used to it. And that's one of those
Yeah.
things, too. When you are doing this, you can discuss changing the treatment plan. If doing it often doesn't work, can we split it up and do it every other day? She's getting such a large amount, it wouldn't work with her. But my other patient, they wanted to do twice a week. So do the 50 mLs, maybe split it up and doing 75 twice a week instead of 50 3 times a week. Didn't work. He started to feel poorly, and they said, you know what, this is working. He was feeling better. It didn't mean that we needed to decrease it. It meant that we needed to keep this going, and that's what we did. We adjusted, and then we add on an extra day if he's having a bad day, and that is something you can do.
Again, everybody's different, and you have
and
to
now
do.
this is like sometimes the worst part of my job. I'm like, I don't want to be the bad guy. If I was at work, I would literally sit there and say, I'm not poking this dog, somebody else do it, you be the bad guy. Because now she's calm
Not me.
and comforted. Yeah, not you. Now she's calm and comforted by me, and I don't want to have to cause her pain. I don't want to have to cause her grief. It is not an easy profession to be in. It's very
I couldn't do
emotionally
it.
taxing.
Yeah.
So
Yeah.
but
I give you all the credit. We need people like you, Tracy. We really do.
I love her.
I
just
know.
want to sit here,
She's
like with
so
the
great.
music and this. It's coming from me right now
Yeah.
too. Like her weight on
And I'm
me.
sure
I'm
she
like,
feels that too.
and that's the thing, like feeling energy. Like if you are sitting there and you have to deal with an anxious pet and you're so anxious, they are so much more scared. They don't know what's going on. And I just want her to know that I'm here for her. I can say it all I want, but I want her to feel it too, because that's going to resonate literally more. Right, Mama? Oh, bless you. Oh, my goodness. I'm glad I wasn't going to kiss your forehead when you sneeze like that.
Oh, Gina, it sounds like, Gina, are you a vet tech or a veterinarian? She used to work at Angel Memorial Boston and Tufts University
Tufts.
School.
That's awesome. Tufts is great.
That's
very, very high end. A great place. I'm sure you probably learned so much there. That's incredible.
Gina has very high praise for you, by the way.
Aw, thank you. I appreciate that.
Oh, she's a vet tech too.
Very cool. So it is just one of the most demanding jobs.
It can't be easy.
If you think about a vet and a vet tech, when you're a nurse, you got to learn everything. I think nurses, doctors, obviously they're amazing, but when you become a doctor, you don't have to learn every single, like a vet has to learn every single animal, like fish to cows. I mean, everything when they go to vet school. They're going to come out and work with cats and dogs 9 times out of 10.
Yeah, not all those animals.
You have to know horses and this, that. They have to know everything.
Well,
if you become a doctor, you have to know obviously all the anatomy, but then you specialize as a surgeon. Not everyone has to be a surgeon.
That's the most difficult school to get into.
Oh my gosh. And if you get into the States, it's incredible. I'm not saying anything out of the States because the schools like Ross just as good, but really impressive. It is very cutthroat. It is very difficult to do. So, when I give vets, veterinarians so much credit because they have to do it all. And as nurses, like as animal nurses, we do so much as well. And just the medical field in general is just so hard. Just like teachers. I don't think teachers get enough credit either. I don't know how they do what they do. I mean, I look at my 5 kids, but it's not an easy field. It's very, very difficult. It has its emotional tolls and
you're a teacher too, and you homeschool. So
yeah. Oh gosh, doing it all. I don't know how I do anything. So
really expertise veterinarian specialist.
I can imagine at Tufts that had to be pretty incredible. Are you falling asleep on me?
She's. So should I take over with the holding so that I can?
Yeah, I mean we can't sit here forever.
No,
so
I know.
Even though
as
she's
much as we want to,
she's calmed down. We're just gonna keep trying and keep going. You never know.
She needs her fluids, so we can't.
Exactly.
Not
you can't.
Do this.
I mean, you could sit there and say, "All right, it's not happening. We can't do it." but it's at a detriment to her. So we are gonna keep trying.
Her little feet are out. Is that
Yeah,
okay?
it's okay. So one of the things, like I was saying, we could try to do, and
Do a little lower.
yeah, try to do a little bit further back.
Okay, sweet baby. I got you. I got you.
Stay, Mama.
It's okay. It's okay,
Okay.
baby. I'm gonna hold you down.
I just got a part. Let's see. You're doing great, Mom. We are in, so we're gonna give it a go and try to put the fluids on and see what happens.
Okay, we got
And
you.
I will know if it's working or not based on the flow. It's flowing, so we're doing good. So see how Jill is just
Yay.
pressing her to her? I don't know if they can't really see, but
I know. We
she's
can't
pressing,
move the camera,
yeah,
guys.
we can't,
Sorry.
we can't do anything. She is pressing her up to her. Muffin is under her chin. We're still kind of using the towel
I
a little
can
bit.
feel Muffin breathing,
Yeah.
and I think she feels my heartbeat. So.
And just like with babies when
Yeah.
they're born, that's skin to skin.
Exactly. I think
It's
this
the
is a
same
good way to
thing.
do it because she's very calm right now. She's not fighting me. I have a really strong hold on her.
We might have
And
gone through a little bit. I feel some liquid, so that's
Oh,
one
no.
thing.
Is
So
that
I'm
bad?
going no. So that's one of the things. If you start feeling the fluid, you might have gone through a little bit, which is why we say to go
What
at
does
an
that
angle.
mean, gone through?
You went through the skin, so that the water is just
Oh.
coming out the other side.
Oh.
So I don't feel the needle,
Oh.
but I feel it might be coming out maybe the other hole that I might have gone when we were trying to do it. So I'm just going to play around with the positioning so that I make sure that she is getting the fluids that she needs, because I'm trying to feel the bubble, and that might be part of the problem, is like just our positioning, because there's a lot of fluid here, and I think it's not coming out. I think it's coming from the other poke that we did when we were trying to do it before.
Oh, that's where it's coming. Okay, but it's going
in. Yeah, but she's
and
definitely
it's flowing.
She's getting it. It's just there's a lot of fluid. Like the fluids are a lot on the outside, but it's not like she's losing it all. She's got a good and now she's like settling into it. She's got a good little bubble that's going, but it is great to tell you guys now, like, here's what we're experiencing. I'm doing this and I can feel all this liquid on her, but she still has her bubble forming, so I know she's getting it. When you use a large gauge needle, you're making a larger hole, so just as after we're done, the fluid is gonna leak out of that a little bit. I think when we poked before, but we didn't do it, I think it was just leaking out of one of those holes, because it's more than you should have, and you'll feel it, you'll see. But we're almost there, so actually we are there. Hold on.
Oh, okay, baby. Okay. I got you.
All right, now we're coming out.
Okay, I got you.
I'm gonna hold this spot, but you're gonna feel it's just really wet. So now we're gonna look and see and figure out how well we did or didn't do. Ultimately, she did get some fluids. I can feel the bubbles, but you see how she's all wet here? But you see how she has this bubble?
Yes.
Feel this here?
Yeah, I feel the bubble.
But you see, we don't normally have all of this.
Yeah, she's not normally all wet.
This is not where I poked. This is where we poked before, so we got a little bit of bleeding. I poked down here. So this wetness is just because, like, I think I said it yesterday, sometimes you go through the skin because the skin is pretty fragile, and it's
Let's get a chicken chip over here.
Oh, yeah. Thank you, Mom.
Yeah.
She's like, where's my chicken chip?
Give her all the chicken chips.
Yeah, you want to eat these too? You can put her down if she wants to, but yes, so this will happen. It's important to.
Ooh, she's like, I'm getting out of here.
But she definitely got it. But I just want to make sure she's not
here. Look, baby, look.
bleeding or whatever. But
yeah,
you can feel it here. So
you can always tell blood on a white dog.
Yeah, so. She got her fluids. I don't feel she got as much fluids as she should have. I can say I don't feel this was her, like, best time.
No.
I don't even know what the word is for it. It's her best time, but the best way to do it. But this is what's going to happen. It's not always going to be easy.
Sometimes
it's not always going to go well. Yeah. But at least she did get some of her fluids. It's leaking, but it's not okay. It's not. She's like, don't touch me anymore.
Run away.
She didn't not get what she needed.
Like,
so,
here's a chicken chip. There.
You know, the amount that Muffin is getting is a large amount. It's 150 mLs for a smaller dog. My other dog that's about her size gets 50 mLs, but she needs a larger amount to kind of reset and get her back where she needs to
They're
be.
flushing her kidneys.
Yeah, to flush her kidneys out. So
she's eating chicken chips now.
So the fact that we said yesterday, you know, you can be relatively safe like this. If a patient had issues with their heart, we don't want to give too much. But when it's with their kidneys, we don't want to give too little. But I know that she's definitely getting the amount that she needs.
There more chicken chips around
yeah, there's
here?
one right here.
Oh, here's another
Here
one.
you go. Here, Muffin. Oh, shake it off. Yeah, and it's always something too. You can try doing like a smaller needle. If this happens like tomorrow and the next day,
We'll get
you're gonna be doing your recheck on Thursday.
Yeah.
And for all the listeners, that recheck is gonna tell us what her values are and let us know if we need to do more fluids, how often, make sure we're getting where we need to be. So what we can do is adjust things accordingly then and say, all right, every time we've been doing this, you know, water, like fluids are leaking out, so we may want to use a smaller needle. We recommend using an 18 gauge, a bigger needle, so it flows a little bit faster, especially at a higher amount. If we're going to decrease that amount, we could sit there and say, you know what, let's try a smaller needle. And that's the beauty of it. You try, you see, it doesn't work, you continue moving forward, you keep trying, and go from there.
You always have options.
There are always options. Yeah. Yep. And it could be something as simple as saying, okay, we can't do this every day. So then what amount should we do? And if we do it every other day? Because we also don't want this to become a stressful event for her, because as you guys know, stress affects your body. So
for sure,
you have a diabetic animal and they come to the vet and they're getting stressed out and you have to check their blood sugar. It's not accurate. It's going to be really, really high because they're extremely stressed out. So we're going to keep doing what's best for her, what she's needed, but we also have to factor in the level of stress, which is why it's so nice to be able to do this, because it's going to be less stressful here than it is at the vet. But also, there may be some pets that are much happier at the vet than they are at home. They go there and they know what it's about and it just works better for them. And it's nice to have all these options. Right, Muffin? What do you have to say?
She says, give me more chicken chips, immediate. Where are the chicken chips?
Oh, man.
I need chicken chips right now.
But you know what? She didn't run away and hide.
No, she didn't.
Scream, cry, yelp out.
No.
It was just difficult, but it didn't come across to me as painful. Right. It is stressful.
And she did calm down once you did it.
Yeah,
she was in my arms. She wasn't tense and freaking.
Yeah.
And she wasn't even licking anymore. So I think it worked out well. Yeah. I'm glad that everyone got to see a little bit difficulty.
Yeah.
Because,
I was going to say,
it's gonna happen.
This is the reality of it. It is not all rainbows and butterflies. And 9 times out of 10, it is difficult.
Yeah.
My other patient, it's been a few weeks and we have a routine down. But it was not easy in the beginning. And the reason we started doing it at home was because of that, which actually something that they do, we might want to consider, is they heat the bag up and warm the fluids so they're not cold going in.
That's not a bad idea.
And she's a tiny little gal, so it's not a bad idea. We can start doing that. You can heat it up for like 30 seconds and see how it feels. You need to shake the bag a little bit, let it disperse out just like you would for us.
Sure.
Might heat up more in one spot. And we can try adding that to the regimen. It works well for Bear. And like I said, we have figured out what works. They use a lidocaine gel on his skin.
That's also not a bad idea.
I don't always go where the lidocaine gel is, so I don't 100% know. It's not like where they put it. I can't always go
you
right
wouldn't
there
know.
when he moves. But you know what? They have a regimen that they're doing. This is what they figured out that works for him, and that's what works. That's what we do. So there are options. There are ways to say, all right, we tried a burrito. I was given insulin to this dog. We were doing it on the table. That's what worked best. There is no rhyme or reason. There's suggestions, and you pivot. And then you figure out what works. Oh, and now she settled down.
No, she's up.
She's like, nope. She looked at me. I'm not going to settle down. I can't let you realize
she heard you. She was like, yeah, I'm not going to let this girl get the upper hand.
She kind of like just tucked herself in and was like, yeah, I'm all right.
Yeah.
Yeah, she's like, oh yeah.
Oh, Gina was just
going
gonna suggest lidocaine.
Yeah.
Gina, I love that you're here on this show too, because
Yeah.
now it's like we've got two vet
Yeah,
techs
I
having a
love it.
conversation.
You know what? A lot of people don't always take any constructive criticism well, and not that this is like criticism, it's a suggestion, but a lot of people don't want to hear suggestions. I am open to any and all suggestions. You don't even have to be a vet tech. You can say, well, when I did this, because I'm always here to learn, been doing this for 18 years, and you're always learning and growing.
Always.
And I had someone ask about doing the lidocaine for the insulin, and it's not really something that we always suggest to do. And so then we started doing it with this other patient, and it just seems
Reggie.
what works for him,
Okay.
so.
Yeah. Okay. All right, now I know who this is now. I didn't realize who it was. Yeah, that's so just so you know, I've got all my Facebook people coming on my YouTube page now, and they all have different names. So they'll be like, they know who I am, but I'm like, who are you? And then they're like, oh, it's me, Reggie.
Very nice.
Yeah, when you see Bam, that's Barbara, but Darla's always Darla. So thank you, Darla. Well, thank you so much. I've taken up so much of your time. This lady, 5 kids, 5 animals, what busy vet tech. I can't tell you how much I appreciate you taking the time, and that Muffin never felt rushed, and she's sitting right next to us. She didn't run away and hide or freak out or anything. She knows that what we're doing here is to help her. I think that,
she understands it.
She does.
Doesn't mean she has to like it.
No.
It doesn't mean it's not going to be painful, but ultimately afterwards she feels better, and it's nice to provide that relief for her.
Yeah, exactly. And thank you so much for your patience.
Of course.
And, little Muffin, she gets her attitude going, but she does. She always knows.
I said when you told me about her grandma voice, and it's like, I kind of want to hear it because I think it would be funny, but you're like, no, it's definitely no good.
Nobody wants to hear grandma voice.
I feel like I jinxed us because she's like, oh, I'm not going to give you the grandma voice, but I'm going to give you a run for your money. So I'm a big believer in speaking of things and things coming to fruition. So I'm not going to speak of that again.
No,
ever.
And you're so right about that. And I've been telling everybody too, what you pay attention to is what you get. And if you're negative, you're going to get negative.
Exactly.
And if you're positive, you're going to get positive. And sometimes you do have to watch what you say, because those negative things come out of your mouth and kind of ruins everything. And by the way, grandma voice is where Muffin, so she yells at me if I don't feed her fast enough. And she starts very slowly. She'll start with her indoor voice. So it sounds like
yeah, she's doing a little bit of that.
And then and then if I'm not fast enough, then it comes in a full blown woof, woof, and she even takes her feet and she stomps. And then grandma
I
voice.
Picture it, because she's just so itty bitty.
She doesn't normally do, but when she does it, And then grandma voice is where she goes like that, and I'm like, no, now I'm in so much trouble.
In so much trouble. That's so funny.
And
Darla, thank you for your kind words. I appreciate that.
Yeah. Yes,
that's truly funny.
And you're right, Darla, and thank you so much. You are a special person, and I'm so blessed that you're here taking care of Muffin and me.
I appreciate it. Everybody comes into your life for a reason, like we've talked about. So this is just as special for me.
That's right. And I think Tracy should be on YouTube. So I am encouraging her
to
do her own special YouTube show. So guys, give her some encouragement, because she's so knowledgeable, and that's what we need. We need real people with information. We cannot do this on our own. And the things that you've learned.
It takes a village, and sometimes you have your village on social media nowadays.
That's right.
And listen,
there's nothing wrong with that.
You can go to social media to find out things, and hopefully people will see this video and relate to it, even if it's just making them feel better because they've gone through similar situations, or they're watching it to learn how to do it themselves and they didn't even know that they could hop on YouTube. Like half the time I don't realize, oh my God, go on YouTube and you can
It's so true. Anything,
very
even
helpful.
This healing music is it's YouTube music. So there's
it takes
a lot of good stuff.
And
You too.
Everybody is a part of Muffin's team, and I think this is a
Yeah.
beautiful thing.
Including you guys.
Yeah.
And I have to say, your prayers, we feel them.
Yes.
Definitely, prayers always help. So don't stop the love and the prayers coming, because we definitely are getting all of your good vibrations.
It's
Thank
a
you guys
big
so
part
much.
of the healing process. I'm a very big believer on
Yeah.
it. So keep it coming.
Absolutely. All right. Well, I'm gonna let Tracy go take the rest of her day off. Yeah, like that's what she's gonna do. She's
never.
gonna go eat bonbons
I
and
got
watch
laundry
soap
to do,
operas.
you know, but
Right.
yeah, I wish.
Yeah, I hear you, girl. Well, someday,
Exactly.
you two can have
It'll
a
be-
life of leisure like
It'll
I
be
do.
well worth, hopefully, with my dogs
Yeah.
who live to be 16 years of age as well. That
Yeah.
is my plan. I love
Oh,
this.
longer. We need longer,
Yeah.
longer.
I've got a husky lab mix, so 16 would be very long for her, but I'm still willing it. I love her.
Yeah,
to
the
death.
bigger they are, the less lifetime
Yeah,
they
yeah.
have.
She's 5 years old, so some people want to say she's halfway through her life. I don't believe it. I
No,
believe maybe a third.
I
That
think
would
with
be
a mama
beautiful.
like you, she's gonna be fine.
I'm hoping.
Yeah,
I love her.
I know. We
she's
love our
very special.
pets. They are members of our family.
Yeah.
100%, if not the best members
Yeah.
of our family.
Don't tell my husband
Just-
that. He
just
knows.
saying.
He knows how I feel about the
Everyone
animals.
knows the truth, and in my
Oh.
family, Muffin's the best one.
my
We
God.
all understand
Of
that.
our cats, but just in general, like Elsa, we have Anna and Elsa to wrap up, and Elsa had passed, so we have Anna. So now Anna is just even more special than she was because she lost her sister. But
Yeah.
it goes Anna,
But
kids, me, and for my husband, and I am so here for it because the bond that they have, it is just I need to start videotaping them
You do.
together.
You do.
Because it's beautiful. I love it.
Everyone
so
loves
much.
to see that kind of stuff
Yeah.
on the internet.
And that
so
their love it's intoxicating. You guys see
it
that.
actually
It
is for
beautiful.
everyone to see animals and people and animals and other animals. Muffin, remember Muffin's support horse Cumbia.
Yeah,
I mean, that was so touching.
I
Those
love
guys,
that.
just animals and people. It's like I always say, when my husband died, I learned one very major thing. You cannot take anything with you when you die. You can't take your clothes. You can't take your house. You can't take your car. You take your relationships.
Yeah.
And
so relationships,
that's
your memories.
the most important thing that you have is your relationships.
I love that so much. It's very
cultivate
important.
them, grow them, and care for them always.
Yes.
All right, I'm gonna let Tracy go now. So
Bye,
thank you so
Thanks
much,
for being
Tracy,
here.
and thank you guys for your participation too. We'll see you on the next Beach Report. Ciao for now.